All right, this video, we're going to talk about chest pain. We're going to talk about you need to know the cause of the chest pain so that you can deal with it properly. You can live your life comfortably and with a peace of mind.
So we're going to go through 3 different steps within this video, and all of these should cover the majority of chest pain that people are experiencing.
Right, now I've had chest pain. I went in 3 times for it. We're going to talk about my experience. And the 3rd step has been very helpful, particularly recent in my life. We'll cover that in detail. I'm sure it's going to help other people as well. I'm Brad.
I'm Mike. Behind the scenes, we have Bob and Heather. We are the most famous physical therapy team on the internet.
You said that fast, but it's true. Yes, it is. Okay, now I do want to talk about my experience with chest pain when I was 50 years old. The first time I experienced it at midnight, woke up, chest pain, little short of breath, wasn't sure what to do, went to the ER overnight. They examined me. Your heart is completely fine. 2 more times since then, same thing. Chest pain, didn't want to go in. My wife says, you're going in. They each time said, my heart is healthy. As a matter of fact, the 3rd time they said, your heart is healthier than most people working there. That made me feel better, but I continued to have chest pain, something that is not very fun because you really don't know for sure. So they said it was musculoskeletal pain, and I thought, musculoskeletal, I'm a physical therapist. I should be able to figure this out. So I did research and I did find out. And what we are going to do is before you go into that step number 2, we got to go to step number 1. If you're having chest pain, you absolutely must
Go see your cardiologist or go to the urgent care or emergency room to get it checked out. You want to make sure it is not your heart first and foremost because that can be deadly, as we know.
Yes, and you don't have to worry about steps 2 and 3. So you're going to find out if you call up your doctor and say, I'm having chest pain, can you get me in as quick as possible? Almost certainly they're going to say, no, you need to go to the ER right now. Just know that's going to happen and go get it out of the way because it could be a heart problem and it could easily save your life. So we cannot emphasize that enough.
So we want to mention that 50% of ER visits are actually with chest pain are not heart related. So that's the good news. Commonly, this can be caused by GERD, which is a reflux disorder or disease people have. I actually had this in my 20s. It's not very fun.
Right.
It kind of can go in your stomach. They put you on some medication for it. Typically goes away, but there's also musculoskeletal conditions called Costochondritis.
Right. Now, I've done this all 3 times. That's what they told me, musculoskeletal disorder. But they didn't tell me what to do for it. And I really don't know if they knew because it's not something that's widespread. But we did find a person who was an expert in it. He lives in New Zealand. And we're going to actually take a trip through memory lane. Bob and I did an excellent video, not only explaining why you get chest pain, but how to treat it through Stephen August's recommendation. Are you ready to go back with the memory lane?
I can feel the GERD kicking in.
It's like Doctor Who. As a matter of fact, the stretching, I think, kind of irritated it.
It could irritate it, yes.
Finally, I found a therapist from New Zealand. Steve August, and he has a very thorough video on it, 15 minutes long. If you're not a therapist, it gets a little boring because he goes through details about how the problem is back here.
Yeah.
And it's like, I didn't buy it at first. That doesn't make any sense.
I thought it made sense to me right away.
Well, of course, but I'm not that bright. And it kind of did, but I thought, I'm always skeptical. You know me, Bob.
Right.
I never take anything at face value until I prove.
Makes you a good therapist.
Yep, I guess so. I don't know. But anyways, so I started his treatment.
So basically what he's saying is tight back here. It's almost here down.
Right.
And if it's tight back here, the movement of the rib cage has got to come from somewhere.
Right.
So it gets hypermobile here.
Right.
So by loosening this, you don't put as much stress on the front, basically.
Right. He talks about the rib being like a handle on a bucket. They
Going up
move
like this.
Up and down, up and down. And there should be a hinge on each side. If the hinge gets a little rusty, analogy, on one side, we need to break it up and get those ribs loose again. So I'm a believer now. I started out, excuse me, Sam, you're no longer needed. here's the whole treatment. This is what you've been waiting for. You've been putting up for this babble for 7 minutes. So here's how we both, Bob and I actually use it the same way. I'm doing it for my costochondritis. Bob likes it for his posture as well as his muscles in his back. It's a good way to get them loose. So I'm going to put it here. And this is my right side. This is where I always develop the chest pain. And I work this side a little more. And I go on there like this. And this is what Steve, the therapist who invented this, I did this on a video once. And he emailed me the next day or a few days later. He said, you forgot to do your arms up and back like this.
Yes, exactly.
So, and I start to do that. Well, warning, if you've never used this before, or if you're using the softball, take a towel like this and unfold it, whatever, layer it up, and then put that over.
And also you may have a pillow under your head.
Yep, and a pillow, exactly.
You may really have to blunt it first to start off with.
Because especially if you're a thinner person, it'll feel a little aggressive. I've been using it for quite a while, and I'd say after a couple of weeks of using this, I welcome it without anything.
Right, but you did start with something,
Oh,
right?
yeah, I used a towel.
I remember you telling me that. It was hard on you.
I just had a cavitation there. It'll make your joints pop a little bit and crack.
This is the first thing I do in the morning. I do it actually while I'm doing hamstring stretches.
You mean like right out of bed, you get on?
I get out of bed. I'm serious, and I go to the bathroom. First thing, wow. I get up. I go to the bathroom. I start stretching, and I put this thing behind my back, and I hit the 6 spots.
Yep.
And I used to have to, like, right before I did a run, I'd have to stretch my back out some more.
Sure.
But this does it for me. This is, and like I said, this has taken away the pain between my shoulder blades. So, the thing I like about this, Brad, too, is that it comes with a booklet.
Oh, yes.
And that we did, what, it was 30 pages?
31.
31 pages. And it's really well written. Yeah. I mean, it goes over the posture things. It goes over a lot of things you can use this for. The Costochondritis is that book almost is worth $10 to me, Brad. Yeah. It gives a good explanation. Are you having fun?
I'm done. I just wanted to show how fast it is. I also treat my SI with it. It feels good. And he has a pasta on that. What I know is my speech
a
to
video on it?
Yeah, I got to, yeah. No, he has a page in there.
Oh, he has a page in there.
Describing on it.
I have not seen that for. I think you mentioned it one time before on one of our videos for a second.
Bob, our viewers are starting to get bored. The main thing is done. We showed how to use the back pod.
You got the alternatives. You can try other things if you don't want to spend the money. But remember, Brad and I can fix just about anything.
Except for
a broken heart.
There we go.
But we'll get that fixed too someday.
We are now back from the past, future, whichever direction we moved in, and the back pod came with us, I guess.
Yeah, there we go. It made it through the vortex, but it is a real nice device. Bob and I still use it on a regular basis. Now, one thing that can happen, you can have costochondritis, treat it successfully, but if you forget to do it or you go on vacation and you may get that chest pain again, and it is very, very, makes a person... Speaking from personal experience, very nervous, and it's not a fun way to live when you have chest pain and you're wondering, I'm thinking it's probably costochondritis, but I'm older. My father had heart problems. My uncles have died from heart attacks, 2 of them. It's in the gene pool. I don't want to have a heart problem, and I need some objective information other than just someone saying costochondritis. So I talked to my doctor. What can I do objectively to find out the condition of my heart? And the discussion came up with doing a CAT scan for a calcium score. Now, this is something, if you want to have this done because you have costochondritis, continuing chest pain, you must go see your doctor or your cardiologist, have a discussion and say, Brad, I'm Bob, and Brad said I could do a calcium test score. Anyways, the doctor will know exactly what you're talking about. They know the scores.
They know Bob and Brad.
We'll see what happens with that. But anyways, a serious discussion, and they'll let you know. My doctor said, I agree 100%. You should take this. And he personally was actually going to take one for himself. What it is, you go through a CAT scan. It takes about 5 minutes at the most. They scan your chest, and it actually looks for plaque buildup in the coronary arteries. And not only does it look at the coronary arteries, it lists which arteries, and it gives a number of how much plaque buildup is in there. The scores goes from 0 to over 400. 0 is the best score. If you have a CT CAT scan of your chest and your calcium score is 0, the risk of you having a heart problem, a heart attack, is very low. And they go from 0 to 10, 11 to 100, 101 to 400. 1 to 10 is you have a very low risk of cardiac disease. Luckily, my numbers fall at 9.77, so I'm in that very low risk. Mike, 11 to 100, can you help me out? Because I don't want to talk all the time.
I'm enjoying this. 11 to 100 means you have mild plaque buildup, so cardio disease is unlikely to have a heart attack then. 100 to 400, you have more of a moderate plaque buildup, so you want to get checked out because you're more likely to develop heart disease. Obviously, if you're in the 101, it's less likely compared to 400. And if you're at 400, you need to go see a cardiologist now because you're probably due for a heart attack soon, unfortunately.
Yeah, so what you want to do, you'll take the test. The test will be read by the radiologist. Then it goes to your doctor, and they'll contact you, and you'll have a complete, detailed discussion of your score. Now, I'm happy with my score, but even more in 5 to 10 years, whatever it may be, if I start to have more chest pain, I can go back, do the same test, and see how my numbers have increased. And not only that, but what location, what coronary artery is more increased. And it's going to be very helpful for my doctor, the cardiologist, or whoever's dealing with it. They have that history, big help. I feel much better just talking about it right now, knowing that I did this. And maybe you should do that.
Maybe. I'm not your age yet.
How is your dad? You got heart attacks in your history family?
One side of my family, yes, but my other side of my family, no.
Is on the male side? Because that's a little more prevalent.
Female side
okay,
it was.
Well,
so I lost my hair from the female side too, so that's no fun.
Yeah, really, family history is probably one of your biggest determinants of if you have risk for heart problems. So that's why I was concerned.
If you want to check out the video on Costochondritis, the full video, you can click the video link on the screen if you're sure that's what you have. It's a good informative video.
Right. Steve August is the guy. If you just search Steve August Physical Therapist, he has excellent videos explaining it himself.
Bob and Brad, the two most famous physical therapists on the internet.